Alright, so this is the abdomen critique video. Alright, so the first thing I'm going to be doing is inspection. I'm just going to be looking over his abdomen, looking for any skin lesions or anything that may indicate Cushing's or cyanosis or hernias or anything like that, and it looks good. And if there were any visible masses, I would palpate them and have the patient turn and cough, ask for any pain or feeling if they disappeared or not. So now I'm going to be listening to the 4 quadrants using the diaphragm. And I would be just listening for any things like origami, or increased bowel sounds, anything like that. Then I'm going to be listening for friction rubs, using the bell over the liver and spleen. And I did not hear any friction rubs. And then I'm going to be listening for bruits. First, I'm going to be looking at the abdominal aorta, which is just superior to the umbilicals. No bruits. Then I'm going to be listening to the renal, which is a few centimeters superior to the umbilicals on the lateral side of the rectus abdominis muscle. So it's a few centimeters superior and just lateral. No bruits for the renal artery. Then I'm going to be listening to the iliac, which is just medial to midway point of the ASIS and the umbilicals. No bruits. And then last, the femoral, which is just inferior to the inguinal ligament, approximately half the distance from the ASIS to the pubes. And no bruits. And then I'm going to percuss the abdomen from the subcostal margin to the pelvis in the mid-sternal, mid-clavicular, and anterior axillary lines. So, mid-clavicular. Good. Axillary. And then the mid-sternal. Good. And then I would repeat on the other side too. For that I would be just listening for gaseous distension or acidic fluid. Then I'm gonna percuss the margins of the liver. On the right side, so we go here, and I start from the bottom. And I'm just listening to when it turns from dullness to residence, and the liver seems to be in the right spot. And then I'm going to be percussing for splenic enlargement. And then for the spleen, I'm going to have you breathe in. And the spleen seems to be in the right spot too. So now I'm going to be gently palpating, starting in the right lower quadrant and going clockwise. And then I'm going to go again, but doing more deeper palpations. Okay. And then if I did discover a mass, I'd have the patient turn and cough, seeing if it disappeared or not. And then now I'm going to palpate McBurney's point, located between the ASIS and the umbilicals. Any pain? Nope. No pain. That could indicate appendicitis. Then I'm going to locate the edge of the liver. Okay, so take a deep breath in for me and breathe out. Good. No pain? Good. And if there was pain, it'd be a positive Murphy sign. And then I'm going to palpate the spleen. Deep breath in and out. And usually this is only palpable in thin people. And since Matt is a fat boy, we can't feel it. Now I'm gonna be palpating for the abdominal and aortic pulse. And I can just barely feel it. Then I'm gonna do the kidneys. Just gonna come underneath you here. This is usually only palpable in thin people too, so I'm not really feeling them. And I'd go the other side too. Then I'm going to be doing rebound tenderness. So deep breath in. And deep breath in. Good. And then I'm going to do some muscle testing. So I'm going to have you bring your leg up. Good. That's for the obturator. And then for the psoas test, I'm going to have you go on your side. And I'm going to have you press against my hand. And good. So that is the end of the abdominal critique video.